the radio energy in cardiac surgery can make the surgical place smoother and helps patients their vision recover faster. ATOS can use much lower treatment doses compared to older femtosecond devices. I want you to move beyond general belief and provide actual evidence. Not just say that low energy works better, but how much of it improves lenticular surface quality in real conditions. When you think about what patients really want to from cataract surgery, it's usually two things: safety and fast vision recovery. Nobody wants to wait several days for their vision clear. They want to come next day and already feel comfortable with their eyesight. What we've seen is that low energy setting really makes a difference. Lower pulse energy makes a smoother surface, which means less tissue reaction, less inflammation, and fewer optical irregularity after surgery. As a result, patients tend to see more clearly in early postoperative period. In my opinion, ATOS is currently best cataract platform for using lower treatment doses safely and effectively. It has a stable beam profile, excellent focus accuracy, and fast repetition rate, all of which allows us to reduce the pulse energy while still achieving precise and complete tissue separation. As more surgeons gain with experience with ATOS and start to really understand the physics behind the femtosecond laser tissue interaction, they will naturally move toward the low energy setting. This is not about just following a trend. This is about optimizing the result and the patient satisfaction. I think low energy protocol will definitely become the smart standard for the smart sight in the near future.